I have the pleasure of being with Dr. Philip Getson and his wife, Leisha, and I want to educate you and talk to them all about thermography because it's been around for a long time, and I want them to tell us what it is, how it works, and how we can benefit from it. So, welcome.
Hi, Elsie. Thank you for having us.
Hi.
Thank you so much.
So, what I want to know, Leisha, for people that might have never heard of this or know what it is, can you explain what is thermography?
You go ahead and take that.
Okay. Thermography is actually infrared imaging. It comes from the Greek words for heat picture. And basically what it is the use of a camera that's specially calibrated to measure skin surface temperatures on the human body. It then converts those temperatures to images on a computer screen that we can then download and measure the absolute temperature from side to side, look at heat patterns in black and white, look at color patterns, and it gives us a great deal of information about the body in a non-invasive fashion. So there is no radiation and there is no compression and there is no pain and there are no injections of dyes. It is simply a heat picture.
Okay, so Leisha, I know you actually have done the breast thermography. So can you help the women understand exactly what that procedure is like?
Sure, it's really quite easy. So, of course, they would call the office. Our main office number is in Marlton. The number is 856-596-5834, and they'll get one of our helpful staff members, and we'll get them on the schedule. This is our main office here in Marlton, but we have 20 off-site locations throughout New Jersey and Pennsylvania and in Delaware. So they make their appointment, they go to the appointed place, they would go into the room. The room is kept at about 68, 69 degrees. The temperature is a little chilly for thermographic purposes. They disrobe from the waist up. That's if we're doing a breast thermogram, they disrobe from the waist up. They acclimate to the room temperature for 10 minutes. Nothing is touching the breast or their back. They don't put a robe on. We just need the whole upper body to cool down. Once the 10-minute acclimation is up, and during that time, I'm just going through their paperwork with them. I take 9 pictures in color. That's followed by a cold challenge. The patient holds an ice pack between their hands for 1 minute, and then I take another 9 pictures in black and white. We're looking at the breast from every angle. The woman is standing with her hands resting on top of her head. So we're taking frontal views, side views, oblique views from every angle. Once the pictures are done, then the doctor here reads the pictures, does the interpreting. Dr. Getson does all of our reading of all of our images, does all of our interpretation. The patients would receive their packet from us within 2 weeks' time, and that would include all of the images, the doctor's report, a claim form for insurance, and we also send the report to any clinician that they ask us to. Once they receive the packet, they have the opportunity to do a 15-minute complimentary phone conference with Dr. Getson to go over the findings. He makes recommendations, things for follow-up, what have you, answers all the questions. We really want to walk people through this process because it's not something that they're familiar with, and we're educating them at the same time. And as Philip said, there is no compression or radiation of the breast. The woman is standing about 3 feet from my infrared camera. Nothing touches her, and it's really that easy.
Yes, and just the fact that there is no radiation at all. I also know that you do this for other situations. Can you talk about that for thyroid, for dental?
Yes. So I guess we've been doing thyroid dentals, I don't know, maybe 5 or 6 years, and it started when I was doing a breast thermogram on a woman. Now, as a technician, I don't ever remark on the pictures. In fact, I'm trained myself not to read the pictures because I don't want to give any false information. But there was such a blatant red line coming from this woman. I believe it was her left breast, coming from her breast and right up into her mouth. So we were both looking at it saying, oh my gosh, what is that? So I just followed the line right up into her mouth where she had an infected root canal. She went to a biological holistic dentist. She got that taken care of. She came back 3 or 4 months later, and that red line of infection was gone. And so that was the start of us doing what we call a thyroid dental facial study. Looking at the thyroid for thyroid dysfunction, we know so many people have thyroid dysfunction, but the blood work is coming back normal. This is showing from a physiologic standpoint whether or not the thyroid is functioning properly. So we're looking at the mouth, right? We know we've got 8 teeth connected to our mammary glands alone. Our teeth are connected to all of our organs. So if one of those teeth is infected and it's connected to your mammary gland, you could very well end up with breast disease. And then since we're looking at the face, we're looking at the sinuses. So it's a thyroid dental sinus study. And it's really just been a wonderful add-on. So helpful in people that they're doing everything right, but something's still wrong, and they're not thinking that it could be a dental infection.
Well, that makes a lot of sense. And when you come in for the thermography, it seems to me that that makes sense to have everything done if you can. That's a great idea. I like the fact that, you know, you actually, from my experience there, you actually receive both the black and white and the color pictures and your report, Philip, and then whatever needs to be done to follow up. So I just want to go back, Philip, and ask you, I know that thermography kind of can show things up much earlier than other tests. So can you explain that for our listeners?
Sure. This is a physiologic test. There are 2 types of tests in medicine, those that are anatomic, like mammograms and ultrasounds and MRIs, which look at the physical body. It looks at tumors, it looks at cysts, it looks for different types of growths. And then there's physiologic, which look at the activity of the organ or the activity of the area that's being studied. So it looks to see how something works as opposed to how something looks. And because thermography is a physiologic study, studies have shown that it will show disease or the beginnings of malfunctioning that can lead to disease as much as 7 to 10 years before the anatomy presents itself. Which means that if you're looking at breast tissue, you may find a malfunctioning or dysfunctional breast that on anatomic study is normal, but the physiology is malfunctioning. So it gives the woman the opportunity to make adjustments in diet and lifestyle, those adjustments hopefully correcting the problem before it leads to something, you know, more serious. Or if it does lead to something, at least minimizing it. It allows us to follow all along so that we're keeping a watch on things and we're becoming a part of the process to help women monitor their own health.
That's an excellent way to understand how it differs from other tests. So who should get thermography?
Well, thermography being so non-invasive and so innocuous, there's absolutely no side effects. There's no downside to doing it. We really believe that everyone should be getting thermograms. We believe that young females, even teenage females, as they begin to develop breast tissue, should be screening with thermographic testing, because a breast cancer that may appear in the 30s or 40s may begin to start cultivating itself in the late teens or in the 20s. And so by watching the physiology, we're really able to help people understand that things are going amiss. And as I said a moment ago, take hold of the thing and change diet and lifestyle. So we're kind of advocating that everyone begin getting thermography at a very early age and follow it along. The same is true with the thyroid dental study, because we're living in an age where the food that we're eating and the care that we're taking of ourselves may not be the way it was 40 or 50 years ago. So what better way to monitor your health with something that's so simple and without side effect?
Yeah. Now, this question always comes up, and the question that people are going to ask is this covered by any insurance?
Well, Medicare sets the standards for insurance, and Medicare is not reimbursing at this time. Although we've sent them documentation after documentation, they're still not covering it. Although I do encourage my Medicare people to just please keep sending in your claim forms, and let's see what happens. Let them know that people are doing this. At this time, we have about 30% of people are getting reimbursed across the board from other insurances. I can't give you any one insurance company in particular, but I can say it looks like people that have dense or fibrocystic breasts, and dense breasts, that's 9 out of 10 women, until we're maybe in our 70s. Our breasts are dense, and that's not a disease. That's not a problem.
Right.
That's just the way that we're made. If there's a history of breast cancer in the family, if they have a disease that would preclude them from having their breast compressed with 40 pounds of weight, which is maybe somebody with reflex sympathetic dystrophy. Those are some of the reasons that we can tell that people are getting reimbursed.
Okay, so there's possibility there, and I agree with you that the more that people alert the medical system to the fact that they want these kind of testings and need them, it's very important. Now, right now, in the middle of this crisis that we're in medically, I know that you also help people strengthen their immune system. So what would you say about that?
Right. So I do some holistic health counseling, and that's that's part of it, right? We've got to keep our immune system strong. One of the things I would ask is, why are so many people immune compromised? That's a big question. Why are so many people immune compromised? I've got my own theory about it, being that with our food being sprayed with Monsanto Roundup and what it's done to our intestinal system, right? We create our part of our immune system in our gut. If our gut is destroyed because we're ingesting Roundup on our fruits and vegetables, and it's in the feed that animals, if you're not eating organic, you're ingesting that. So I talk a lot about restoring gut health, and we have some wonderful products that we use. One of them is actually called Restore. So that's the first step. Then, common sense things. Move your body, get some exercise, even if you're at home. Now that you're at home, take walks out in the sunshine. You've got to drink plenty of water. Stay hydrated. You should be drinking half of your body weight in ounces of water. Try and get enough sleep, maybe 8 hours, 8 hours of sleep if you can. If you're home, rest. We've got this gift of this time to rest and do some inner work and reflection, maybe start your yoga practice, your meditation practice, whatever it is that works for you. So staying out of the fear, whatever that takes, is tremendous. What this is doing to our immune system because of the fear. People are in fight or flight now, as we were before, but now it's amped up on steroids. So whatever people can do to bring themselves back to center. And then some things like getting zinc into your diet with seafood, pumpkin seeds, sea vegetables, beans, and lentils. Vitamin D, make sure you're taking your vitamin D every day. You can get that through salmon, fatty fish, egg yolks. Your vitamin C, right?
Yes.
Getting your vitamin C, orange, papayas, strawberries, organic leafy greens. And whenever I'm talking about food, I'm always talking about organic, even though I don't say it.
Right.
Vitamin E, and that's in liver, mackerel, salmon. Fresh garlic is very good. So you want to crush up some fresh garlic, wait 60 seconds to enhance formulation of allicin, and that's ALLICIN, and then you want to ingest that. So those are just some easy things that you can do to keep your immune system strong. And of course, you're going to be following the recommendations to wash your hands and, clean your surfaces and do all of those things.
Mm-hmm. Yes, those are all excellent ideas. Thank you, Leisha. And Philip, I want to go back because I know you have a long, long history with thermography, and you actually fought the insurance companies in order to get this approved for your reflex sympathetic dystrophy patients. So tell us a little bit about that journey, because that really took a lot of courage.
Well, the journey actually started in about 1984. I began doing thermography in about 1982, and we were looking at patients with neuromuscular disorders, many of whom had been hurt in automobile accidents. And so we were billing the automobile carriers for the performance of thermographic testing, and they were denying payment. So I had a friend who was willing to take on the battle with me, an attorney, and together we sort of went to war. And so we sued the insurance industry, and we wound up suing Allstate, State Farm, and the state of New Jersey, because we figured if we're going to sue the insurance industry, we might as well just sue the biggest ones. And Allstate and State Farm, of course, are the two biggest insurers in America, at least they were at the time. So we had a trial that lasted 7.5 weeks in Camden, where witnesses flew in from all over the country and testified on both sides. And the judge in the case, there was no jury, the judge in the case ruled in our favor and said that the insurance industry had to pay for thermography. Well, the insurance companies appealed that, and a year and a half later, it went to the appellate division, who upheld the decision and said the insurance companies had to pay us. And they appealed that, and it wound up in front of the Supreme Court of the state of New Jersey. Well, by this time, Allstate and State Farm had fired their local counsel, and they brought in counsel from their home offices in the Midwest. And so we got to the Supreme Court of the state of New Jersey, my friend, the lawyer, with his law school briefcase that was well worn some 25 years later, and myself with a off the rack suit. And we showed up at this Supreme Court to be heard. And for those people, and most everyone who's never had the opportunity to see this, it's really astonishing. I mean, it's a glorious thing. So we walked in, we were there first, we sat down, we were waiting for Allstate's lawyers and State Farm lawyers, and they came in with their $5,000 suits and their Zero Halliburton briefcases, and they were very prim and proper, and they seated themselves at the table. And the Supreme Court justices, all five of them, came in, and Allstate's lead counsel stood up, and he buttoned his jacket, and he flashed his cuffs, and he took a deep breath, and the lead Supreme Court justice looked at him and said, "Sit down." And he pointed to us and he said, "They win, you lose, pay them. We're done here." And so it became, there was no testimony done. We walked out of there 5 minutes after the whole thing started, with what has now become law in the state of New Jersey that said thermography is a reasonable and necessary medical expense under the PIP statute, the motor vehicle statute in the state. The journey took a little bit over 10 years. And it was the first one of its kind in this country. And it is still referenced in other states as the landmark decision on thermography and its usage in injuries sustained in motor vehicle cases.
Oh, what an incredible story, especially in this day and age. So, what are some final words, ideas you'd like to give us or talk about in reference to thermography for our listeners here? Go ahead.
I think that I would say to people, you know, you have to do your due diligence. You have to look at what's available for yourself. But we live in Western medicine in a place where we wait until somebody develops some kind of illness and then we try to undo the problem. Whereas in Eastern medicine, it's all about preventative medicine. And I think as we're moved into the 21st century and with each passing year, we're looking more and more at preventative medicine and what steps we can take to keep ourselves healthy before we get sick. And I think thermography is exactly that. It gives people the opportunity to look at themselves in a non-invasive, safe fashion and say, there's something that's not quite right. We can identify that. And now let's take whatever steps are necessary to make ourselves feel better and keep ourselves as healthy as possible. And that includes, as Leisha said, the way that you eat and the organic food and so many other things, you know, clean air and exercise and all those things that we're hearing more and more about doing. And so it's a wonderful way to monitor the health of an individual in a safe fashion.
Yes, I like that term, in a safe fashion. It absolutely is. And just to be able to, you know, get that breast screening with no radiation, no compression, and have an advanced look. And I agree with you, Philip, about women getting that younger and younger.
I think so. I think because with the hormones and the steroids that they're putting into the animals that are producing the food that most people eat when they're not eating organic, we're seeing young girls develop breast tissue well earlier than they used to. Sometimes, you know, you're seeing 12 and 13-year-olds who look like they're 20 and 21-year-olds when we were younger. And so the hormones that are being put into the food that most people are eating make it necessary for us to become more proactive in looking at these individuals, these young girls, at a much earlier age, because the development has changed and so has the disease process and the timeline for it.
Yeah. I would say that thermography allows women to maintain their dignity while being proactive in their health and wellness concerns. It's a It's a wonderful, gentle, yet very effective test. And as we've said, there is no compression or radiation, and they can feel good about it. And we're part of what we do is education and trying to take some of the fear out of this whole breast cancer industry, giving women tools that they can use to maintain or regain breast health and then overall health.
I'd like to add, Elsie, that this is not a test that you need a prescription for from a physician or a referral. Sometimes it helps with reimbursement, but women who have decided to take their health into their own hands can self-refer. They can pick up the phone and call and be tested without a physician referral, which makes it even better because now it's self-empowering. You're doing something for your own self in your own way, and you're not a subject of the medical system as it exists. And I think that further helps people understand. We're helping them understand their condition, but it makes people feel more empowered about themselves.
Well, that seems to be a theme as we're looking at what's happening now. And what you're actually talking about, Philip, is that self-accountability and taking responsibility for our health, which is so important, especially since we're living so much longer.
Yeah. Right, yes.
So thank you both for joining me. And it's always good to talk to you. And I know that you also have that little video that I'm going to put up underneath so that people can look at the actual procedure that goes through for the breast thermography. Okay, be well. Take care, everybody. Thank you both.
Thank you, Elsie.
Have a good day.
Okay.
Bye.
Bye-bye.
Bye.